Hey guys, welcome to the fundamentals video for this week. We're going to be introducing the knee chest table. We're just going to be talking about perfect patient placement, what the heck a knee chest table even is and why we love it, and it's so important here in the Gonstead world. I am Rachel. I'm a quarter 9 student here at Palmer, and I'm an officer in the Gonstead Club.
Awesome. I'm Kayla. I'm a quarter 4 student, and I'm going to be an officer next quarter in the club. So I'm going to start off by talking about the anatomy of this table. So this first portion that you see here is actually where a patient will place their knees, and we'll talk about how patients actually get on this table in a second. But the next portion is actually the chest piece here. So the chest piece has a slot in the middle, and this is where your patient is going to be putting their face. So you want their face to be towards the top of that, and we'll talk about that in more detail. In addition, not only can you put like full-size people in here, you can use this portion to actually adjust babies. So that's a really popular thing to do. There's also these leaves. So the importance of that is that you can set it up to where you can actually adjust small humans, such as children. So this is completely customizable to whoever you have on the table. That's the biggest benefit, and that's why we call it the Great Equalizer, because no matter how big you are or how little you are as the doctor, or how big or small your patient is, you can put them on this table and you're going to be able to get their spine to kind of relax down into that P to A fashion. That way they're able to get the best adjustment possible, and the key thing is to make sure that everybody's relaxed and that they're comfortable. So Rachel's going to go into a little bit more detail as far as that goes, and we'll show you what perfect patient placement looks like now.
Perfect. So first of all, like she said, we really want to make sure that our patient is comfortable, that we're comfortable, or else this just isn't going to work. But before we start this, because this is where we're focusing on the adjustment, we want to remember that before we ever get to the adjustment, we would have already done our full Gonstead analysis on our patient. So we would have began with scoping our patient and getting those specific areas where the subluxation is. We would be looking at our x-rays. We would go through static palpation as well as motion palpation. Just a quick reminder, motion palpation is where we're actually having our patient sit down and we're moving her spine, and we're trying to figure out exactly how the vertebra is subluxated. So we have that posteriority component, we have the rotational component, as well as our lateral bending, finding that wedge. So based on all those things, we already have a good idea of where the subluxation is and exactly how we want to fix it before we ever move to the knee chest table. So now that we've already done that for Kayla as my patient, I want to figure out how I want her set up here. So like she already touched on, we do have the leaves. So the really important part about the leaves is that we want to adjust it so that whatever part of the patient's spine that we're adjusting is the highest peak. And you'll see that once I get her positioned. I'm actually going to position her a little lower just to show you what that looks like. But usually when we move the leaves, we're going to want to go 1 and 1 or 2 and 2. So if you can kind of see, we have different segments here. So I have this one on the lowest one and this one on the lowest one, just to start out with. Take your time with this. The patient is probably more often than not that you're going to get your patient down, and it's not exactly how you want your patient to look. And if you have to get them up, that's fine. It's better to take your time and make sure they're placed perfectly so that we can really ensure that we're giving them the best care and making sure that the adjustment goes well. So we're going to focus on her thoracic region today. So when I set her up, I want to make sure that that is the highest peak. But before we get her down, let's walk through how we're going to instruct our patient. It's really important that you guide them through. We don't want them just to jump down and then jump up, because it could risk them getting injured, and we do not want that. So to start with, we're going to have our patient standing behind the table, and I'm going to tell them, take your dominant leg and just place it out to the side. So whatever leg's your dominant one, great. So that way now she can drop her other leg down and she's pretty balanced there. And then she'll bring her other leg to meet on the knee chest. She'll grab the face there and then lower her face down. So see how she just nicely comes down, she glides up. We want to make sure that she's positioned to where her throat, she kind of mentioned earlier, but she's going to come up so that her throat's not getting choked by that piece. and she's comfortable there. How you feel? Okay right there? Good. So here, another thing is once they're down, we want to make sure that their legs are not specifically parallel here. She's got them a little bit pushed back. That way when she relaxes down, her belly can just kind of drop down there, and she's comfortable. Good. So if we look at her here, I'm going to be focusing on her thoracic region here. And if I look, she's pretty even, but I would say that her sacral area is probably the peak in this position. And like I said earlier, I put her on a 1-and-1. So I don't like the way that this looks for the thoracic adjustment. So I'm going to say, all right, Kayla, I'm going to get you up just for a second. Good. And I'm going to bring it up to 2-and-2. And most of your patients that you will have probably will be around that 2-and-2 setting. And then again, she's just going to come down. Great. And she's comfortable there. And now you can see that this thoracic region is kind of my highest peak here. And she looks comfortable, looks good to me. So if she were to drop her belly down and just relax, that's where I want her. And I always tell them to drop their belly down first, just so you can kind of get an idea of how far they're going to be able to relax. So you know when you're going to deliver the adjustment where that point is for them. So that's really it for patient positioning. She's comfortable. Just make sure that when she does drop her belly down, that her musculature isn't tensing up. If it's tensing up, she's not comfortable. It's not the good setting for her, and the adjustment's not going to be delivered very well. So in that case, if it was to start kind of spazzing or tightening up, I would get her up, reposition her. And every patient's different, so you just kind of have to play around per patient and figure out what is right for them. And usually a lot of docs, when they get that number 2-and-2 or however it is, they're going to write it down in the notes so that you know from then on out. So here she is. We're going to focus on the specific adjustments and contacts and everything in the later videos coming this week. But I'm just going to give you a general idea of what it's going to look like if I were to adjust my patient here. So she's perfectly placed. If I were to come into the contact or the thoracic region and get my contact, we're here. And it's a really important thing that you do. It's like an arcing motion with the knee chest. So I'm going to start here, and I'm going to have my patient take a breath and just really relax that belly down. Now as she's relaxing down, I'm making sure I'm lifting, and that's kind of where that arc is coming through. I'm lifting, and when she's at the bottom of that breath and really relaxed and ready, I'm going to deliver that thrust. Like I said, we'll focus more on really going through all of those mechanics later. But the most important thing I would say with the knee chest and giving this adjustment is that when you thrust, you want to make sure that you hold and hold for a second. You don't want to thrust and recoil like some other techniques do. We really want to make sure that we're just thrusting and we're holding. And that way, sometimes if you were to thrust, it kind of stings the patient, so it's not comfortable for them. They could end up hurt, and it doesn't give them a good taste or idea of the knee chest table. So now that we've delivered our adjustment, Kayla, here, go ahead and get back down. We're going to show them how to get up. So we did our adjustment. So I'm going to have her slowly. I don't want to help her because as a doctor, one, I could get hurt if I'm trying to lift her up, but I just really want to make sure that she can get up safely. So we just did the adjustment. She's going to slowly come up and bring her hands to the face of the chair. Great. Come up, and then she's going to do just in reverse. Bring her strong foot up, and she's going to come up. And there you go. And I didn't touch her. I didn't help her. We're both safe. She got a great adjustment, and we're ready to roll. So thank you guys so much. It was just a quick intro video. We hope we helped you guys out and gave you a good idea of what the knee chest table is.
Yep, so thanks for coming. See you next time.
See you next time.